This video is for educational and informational purposes only and should not be considered professional coding, medical, or legal advice. Hello and welcome! I'm so excited you're here. This is Module 1 of our Medical Billing and Coding Certification course, and whether you're brand new to healthcare administration or you're someone looking to formalize your skills and earn a credential, you are in exactly the right place. Over the next several modules, we're going to walk through everything you need to know to pass your certification exam, whether that's the CPC through the AAPC or the CCS through AHIMA, and more importantly, to actually do this work in the real world. Today, in Module 1, we're going to cover the big picture. We'll answer 3 essential questions. What is medical billing and coding? Why does it matter? And what does a career in this field actually look like? Let's dive in. Here's our agenda for today. We have 5 main topics. First, we'll look at the healthcare revenue cycle. This is the big picture system that every billing and coding professional operates within, and you must understand it before anything else makes sense. Second, we'll focus on what medical coders actually do day to day, because a lot of people confuse coding and billing, and they're really 2 distinct skills, even though they work hand in hand. Third, we'll flip it and talk about the biller's role, how claims get submitted, appealed, and paid. Fourth, we'll talk about your certification options. The 2 big ones are the CPC from the AAPC and the CCS from AHIMA. But there are others, and we'll help you figure out which fits your career goals. And finally, everyone's favorite topic. We'll look at salary data and job market outlook, because this field is genuinely growing and the numbers are encouraging. All right, let's get started with topic 1. Before we can understand what a coder or biller does, we need to zoom out and see the full picture, the healthcare revenue cycle. Think of this as the journey money takes through a healthcare organization. It starts the moment a patient calls to book an appointment, and it doesn't end until the final payment is collected. Let's walk through each step quickly. Step 1. Patient scheduling. A patient books an appointment. Seems simple, right? But even here, the revenue cycle has begun. The scheduler may verify insurance, check for referrals, and flag any prior authorizations needed. Step 2. Registration and eligibility. When the patient arrives or checks in, their demographic and insurance information is captured and verified. If the insurance isn't active, you find out now, not after you've delivered care. Step 3. Clinical documentation. The provider sees the patient and documents the visit, the chief complaint, diagnosis, procedures performed, medications prescribed. This documentation is the foundation of everything that comes next. Step 4. Medical coding. This is where you come in as a coder. You review that clinical documentation and translate it into universal codes. Every diagnosis gets an ICD-10-CM code. Every procedure gets a CPT or HCPCS code. These codes tell the insurance company exactly what happened. Step 5. Claim submission. The biller takes those codes, packages them into a standardized claim form, the CMS 1500 or UB04, and submits it electronically to the payer. Step 6. Payment and follow-up. The payer processes the claim and sends back an explanation of benefits. Gius Dicit, the EOB. If they pay, great. If they deny or underpay, the biller works the denial, appeals when appropriate, and ensures maximum reimbursement. This is the machine you're joining, and understanding the whole cycle makes you a far more effective professional at whichever part of it you specialize in. So what exactly is medical coding? At its core, medical coding is about translation. A provider sees a patient, documents the visit in plain clinical language, and it's the coder's job to convert that language into a standardized set of numeric and alphanumeric codes. Why? Because insurance companies can't process claims written in plain English, like patient has diabetes and came in for a checkup. They need codes, universal codes that every provider, payer, and clearinghouse in the country uses the same way. There are 3 major code sets you'll learn in this course. Number 1. ICD-10-CM codes. ICD stands for International Classification of Diseases. These codes describe diagnoses, the medical conditions, symptoms, and reasons a patient sought care. For example, the code E11.9 means type 2 diabetes mellitus without complications. There are over 70,000 ICD-10-CM codes, and they're updated every October 1st. Number 2, CPT codes. CPT stands for Current Procedural Terminology, and these codes are owned and maintained by the American Medical Association. CPT codes describe procedures, what the doctor or other provider actually did to or for the patient. Everything from a basic office visit to a complex surgery has a CPT code. 9923, for example, is one of the most commonly used codes. It describes a moderate complexity office visit with an established patient. Number 3, HCPCS Level 2. These codes fill the gaps that CPT doesn't cover. Things like durable medical equipment, ambulance services, dental procedures, and certain drugs. These codes start with a letter, followed by 4 numbers. As a certified coder, you will work with all 3 of these systems constantly. You'll become fluent in this language. And it is a language. It takes time to learn, but once you have it, it opens doors throughout the healthcare industry. Now, let's talk about your certification options, because this is one of the first questions every student asks. Which exam should I take? There are 4 major credentials you'll hear about in this field. Let's go through each one. First, the CPC, or Certified Professional Coder, offered by the AAPC. This is the most widely recognized coding credential in the United States, and it's the one most commonly required for outpatient and physician office coding jobs. If you want to work in a clinic, private practice, or outpatient setting, start here. This is the credential this course primarily prepares you for. Second, the CCS, or Certified Coding Specialist, offered by AHIMA. AHIMA is the other major credentialing organization for health information professionals. The CCS is more focused on hospital coding, inpatient diagnosis-related groups, or DRGs, and complex facility-based coding. If you want to work in a hospital or large health system, the CCS may be your goal. Third, the COC, or Certified Outpatient Coder, also from AAPC. This focuses specifically on hospital outpatient coding, which uses a different system called APCs, or Ambulatory Payment Classifications, than physician office coding. Great credential if you want to specialize in hospital outpatient departments. Fourth, the CPB, or Certified Professional Biller. This one's different from the others. It focuses on the billing side of the revenue cycle rather than coding. If your interest is more in claims management, denial appeals, and revenue cycle operations, this might be your path. My recommendation for most people starting out? Start with the CPC. It's the most portable credential, it opens the most doors, and there are CPC jobs in literally every healthcare market in the country. We'll talk more about which exam to take in a dedicated module, but for today, just know your options. Let's talk numbers, because one of the best things about this career is the data that backs it up. According to the Bureau of Labor Statistics, jobs for health information technicians, which includes medical coders and billers, are projected to grow 11% from 2022 to 2032. That's faster than the average for all occupations. Healthcare isn't going anywhere, and the administrative infrastructure that supports it needs skilled professionals. Salary-wise, certified coders typically earn between $48,000 and $72,000 per year, depending on their credential, their specialty, their experience, and their location. Coders in specialties like cardiology, oncology, and orthopedics often earn on the higher end of that range. And as you gain experience and additional credentials, your earning potential increases. There are roughly 450,000 employed health information technicians in the United States right now. That's a big, established workforce. And there are constant openings because the field is growing and experienced professionals retire or move up. And then there's the remote work factor. This is something I really want to highlight. Medical billing and coding is one of the most remote-friendly careers in healthcare. Over 60% of coding and billing positions can be done entirely from home. If you're looking for a career that offers flexibility, work-life balance, and the ability to work from anywhere with a secure internet connection, this is one of the best options in the healthcare space. So why this career? No patient care required, no bedside manner needed, just attention to detail, analytical thinking, and a willingness to learn a new language, the language of codes. All right, I want to wrap up Module 1 with a summary and then give you your first assignment. Okay, let's wrap up Module 1. We covered a lot of ground today, so let's lock in the key takeaways before we go. 1. The healthcare revenue cycle is the backbone of everything. Every coding and billing decision you make exists within this cycle, and understanding the big picture makes you a better professional at every step. 2. Medical coders translate clinical documentation into 3 major code sets: ICD-10-CM for diagnoses, CPT for procedures, and HCPCS Level 2 for supplies and other services. 3. Medical billers take those codes, build claims, submit them to payers, and manage the entire payment process. Coding and billing are related but distinct skill sets. 4. Your 2 primary certification options are the CPC from the AAPC and the CCS from AHIMA. We'll explore these in detail in a later module, but start thinking about which direction fits your career goals. 5. This is a genuinely strong career field. 11% projected growth, competitive salaries, and significant remote work opportunity. You made a great choice getting into this. Now, before you move on to Module 2, I want you to complete the Module 1 workbook. You'll find a revenue cycle diagram exercise where you'll match each step to its description, and a code set comparison worksheet that'll start building your familiarity with ICD-10, CM, CPT, and HCPCS. Don't skip the assignments. This is the work that cements the concepts. In Module 2, we're diving deep into ICD-10-CM, the code structure, the official guidelines, and we'll start practicing actual diagnosis coding. It's where the real work begins. I'll see you in Module 2. Take care.